Hi, I'm Michelle Chadwick and I'm from Sleep Disorders Australia. The 5th of May is Australia's Sleep Apnea Awareness Day. So today I'm talking to ear, nose and throat specialist Dr. David McIntosh, and we'll be speaking about snoring and sleep apnea and just everything about obstruction of airways and sleep in general for adults and children. So I guess nearly everybody knows somebody in their family with snoring. Is that normal?
So it's a really good question, because when we have these conversations, it's really important that we differentiate between children and adults as well, because otherwise we can give answers that aren't actually applicable to one group that might be applicable to another. So if we start with adults, because that's how the history sort of evolves. So what happened is that we noticed with adults, there was a group of adults that was snoring and having lots of car accidents. And it turned out that they were the ones that had the sleep apnea. They were the ones that were tired and falling asleep behind the wheel, basically. So once the medical community clicked to the fact that there was something going on there was a very proactive push, which makes sense, to get people breathing well and sleeping well at night. And we tended to then just ignore everybody else. What we've found over time with adults, though, is that even just the presence of snoring in adults does increase the risk of what we call cardiovascular disease. So that's things like heart disease and stroke. So snoring basically is a noise that is made when there is a blockage to the breathing. So at no time is it normal to have a blockage to your breathing.
No.
So that's adults in a nutshell. And then what we did with children is that we recognised, again with children, that there were a group of children that was stopping breathing at night, just like the adults were. And we focused on those children. But the problem was that there was a group of children that were struggling to breathe. They were snoring, struggling to breathe at night, but they weren't stopping. When we started addressing them, they started to improve. And then we started looking at the kids that were just snoring pretty regularly, and we started addressing them, they started to improve. And the thing we've learnt with children is you don't even need to be snoring. Simply just mouth breathing is enough to be a sign that there's a breathing problem that can affect their oxygen levels going to their brain at night, which again, just by virtue of that one statement, is clearly not a good thing.
No.
So to answer your question, the roundabout, long-winded way, if you have a cold or a flu, or you're tired and run down, you've had a busy day, or for adults, and hopefully it's only adults, where they've had some alcohol, look, there'll be some snoring, but we can put that down to a certain circumstance, and also expect it to be a intermittent one-off scenario. The pathology arises is when this is basically a pretty persistent pattern of abnormal breathing. So that's hopefully your comprehensive answer about snoring.
Right. So what causes airway obstruction?
So the easy way to address that is to basically break the airway up into sections. So section number one is through the nose. So there can be a host of things that can cause problems within the nose, in terms of breathing through, getting air through the nose. So anatomically, we talk about the middle portion of the nose is called the nasal septum, and that can be crooked. Within the nose, there can be allergy swellings, so that can cause nasal obstruction. More so in children than in adults. Behind the nose, there are these things called adenoids that may be too big, so that can cause an obstruction. So that's the level through the nose. And then we look through the mouth, and we sort of start with, well, the first thing you see is actually the tongue. The tongue could be too big. Or alternatively, behind that, the tonsils could be too big. And then we go down to the lower part of the throat. Within the lower part of the throat, there's another part of the tongue. So the lower part of the tongue could be a problem. There are tonsils that sit lower down on the back of the tongue, so they could be a problem. Or the muscles around the throat could be weak, and they could be collapsing down as someone is breathing in. Instead of the throat staying open, it actually closes down on itself. And then on top of all of that, we can have the situation where the development of the jaw, so the top and the bottom jaw, may be underdeveloped. And if that's the case, that means the space within inside the mouth, within inside the nose, within the throat is actually smaller. So in that scenario, it actually gives you a situation where that throat is easier to block, simply because there's less space available to start with. So they're, in general sense, the main issues that can be playing out in these sorts of scenarios.
So what happens when you stop breathing in your sleep?
So when we stop breathing in sleep is very much the same as when we stop breathing when we're awake. The difference is that because we're conscious, the brain doesn't let us do that for too long. But what happens is whilst you're doing that is the oxygen is starting to drop. So when we take a breath in, there's the air that goes into the lungs starts to absorb that oxygen. But then we need to breathe out and take another breath in. If we're not breathing, it's no different to someone choking you. If someone was to come and choke you at night, that's not going to be very conducive for surviving for very long. It's very much the same scenario.
Okay, and so what are the impacts of sleep apnea, and how does it affect your cognition and your behaviour and other physical conditions?
Yeah, so when we look at this, we can break the body down into different body parts, and that can be sometimes quite a useful way to approach these situations. And the thing about sleep apnea is it actually affects every single body part that you want to nominate. So I've mentioned the cardiovascular system. So it does things such as puts a strain on the heart, so you can end up having a heart attack. The heart rhythm can become abnormal, so you can develop what's called an arrhythmia, which is where the heartbeats are not the normal heartbeats as they should be. You can then have things, as I said, with things such as a stroke. You can also have high blood pressure. If we change body systems to, for example, what we call the endocrine system, which is our body hormone system, diabetes. So you're basically the way that you cope with blood sugar is impaired, so that your blood sugar levels go up, so you can become diabetic. Then you can have the consequences of diabetes, which apart from feeding into heart attack and stroke again, have other sorts of issues such as kidney disease and what we call peripheral vascular disease, which is one of the reasons, for example, where people can end up losing a limb simply because the blood flow has become so depleted. So we have those sorts of scenarios. We focus then on the brain, because the brain's an important function. And if there is not enough oxygen going to the brain, then the brain's ability to get restorative rest, which is the whole point of sleep in the first place,
Yes.
is impaired. So as a consequence of that, we have a situation where if anyone that knows that they haven't slept well, they're not necessarily the brightest and happiest person the next day. They're tired, grumpy, and so forth. Well, that's really just, again, reflecting the fact that there is a disruption to the sleep patterns, and the consequences of that is you have a dysfunctional brain. So we notice that particularly in children, where they can become quite emotional, have trouble with their concentration, their schoolwork. In adults, they tend to be tired. In children, they tend to be hyperactive. So we know that around about 25, if not maybe even as high as 50% of children given the diagnosis of ADHD are actually simply just sleep deprived and not had a good night's sleep. The other thing then is that can flow on to mental health problems. So we know things such as depression, anxiety, schizophrenia, bipolar affective disorder, and post-traumatic stress disorder, or PTSD, are actually elevated as well. We know that there can be problems with the way the eyes work, the problems with the way the ears work, the problem with the way the liver works, problems with the way the gut works. Essentially, it's a really broad dysfunction of the whole body system. It really highlights just how crucial sleep is to normal health and well-being.
And what treatments are there? You mentioned that the obstruction can be in the nasal passage or in the mouth. So I would think that a CPAP machine wouldn't be the answer for everybody.
So what we're realizing, the way that the history started is we found that the people not breathing properly, if we could put what's called a CPAP machine on, which is a mask that pumps air in, then basically we can force the air through the blockage to some degree. But if you had a blocked pipe at home, or something was wrong with your kitchen sink, you wouldn't expect the plumber to turn up and simply just put a pump on the sink. You'd expect them to look inside the pipes and try and work out what's going on. And that's what we've learnt with obstructive sleep apnea, is that CPAP is actually a really good treatment, but unfortunately only about 30 to 40% of people actually stick with it.
Yeah.
And some of the big reasons that they don't stick with it is because they have a blocked nose, they have big tonsils, they haven't been educated properly. And sometimes, when we address those things, we can get them into a situation where they don't need the CPAP, or if they still do need the CPAP, we've actually set them up for success rather than failure.
Right.
And that really is just a simple, common sense thing, is that if we have a clinical diagnosis, that should be done in conjunction with a clinical examination. We don't make diagnoses of other medical conditions without physically looking at the patient first. So, obstructive sleep apnea is not about what the test result shows, it's also about what's causing it. And then we can tailor the treatments to that. So for some people, if it's a physical obstruction, then we can surgically remediate that, or if it's allergies, we might be able to remediate that with medication. If the lower part of their throat's collapsing, a dentist may be able to organise for them to wear a mouth guard at night, and repositions the jaw and holds the throat open. And then, CPAP certainly is very important, but we need to make sure we haven't missed any causes. So
Right.
we want to make sure that their thyroid gland is working properly, because if their thyroid gland is not working properly, the muscles of the throat will lose their strength and collapse in. Likewise, if they have reflux or heartburn or indigestion, that can cause swelling within the throat, which could cause the obstruction. So it'd be a matter of treating that with the diet, lifestyle, medication to settle those things down. So I think what we're realising as we progress with this story is that we are getting into the era of what we're calling personalised medicine, which is where we are working out not so much how bad is a person, but why are they bad? What is the underlying problem that's led to them being in front of us with this condition? So it's always important to not just ask the what, but also to ask the why.
Yeah, so I guess it's really important that if you do suspect that you have sleep apnea, or you suspect that your bed partner may have sleep apnea, that they should see a doctor rather than just have a sleep study and use a CPAP machine, and then if they feel that that's not working, give up and then that's it. They should really speak to a doctor, because there could be something that can be done to help them.
Yeah, look, and that's right. Look, and often, but not always, a sleep study will be done on the referral or recommendation of a doctor. But what's important, again, is that it's not just about having the test, but that if someone looks at a cause. So if you were to have a blood test and they were to find that you had a low blood count, that you're anemic, it wouldn't be good enough to just say, oh, we'll just need to give you a blood transfusion. You actually need to go, well, why are you losing blood? Where are you losing it from? What's the underlying cause? We sometimes have to treat a test result quickly, simply because the findings, dictate that there is a treatment that's needed just to get someone out of trouble. But we always eventually come back to the cause. Why did this person end up with this problem? What do we need to do to reduce the chances of this happening again? Is it a sign of something sinister? So, for example, for someone that's losing blood, we always worry that they might have a tumour somewhere. For example, bowel cancer, and they could be losing blood through their gut. Tumours can cause airway obstruction and be a cause of sleep apnea too.
Right. So what are the signs and symptoms of sleep apnea? What would lead you to think that you may have sleep apnea?
Yeah, so in adults, often the two common scenarios is one is that their bed partner is complaining about the snoring, and in the process that may be waking the partner up, and the partner is observing and is aware of periods of sleep apnea. So that's a good sign or indication. And the other one is in the process of somebody that may not have that witness to the fact, but someone that's consistently waking up tired. Is sleep apnea is on the list of things that we need to go looking for. It's not the only cause of tiredness, but it's an important one to go and look for amongst everything else that we would assess for. With children, it gets a little bit trickier because they don't even need to be snoring. They just simply, like, mouth breathing can be enough to be causing problems. So where the challenge lies in children is, firstly, it comes mostly down to the parents, but it's not unusual that the parents will have basically got the kid ready for bed, got them into their bedroom, and then the parents disappear down the other end of the house and don't really have any idea or insight. But the clues, again, is if the child is waking up tired, that's a really big clue that there's been a sleep problem. If the parents can take the time to go and watch and listen, and these days with the mobile phones, you can actually record it, which makes it very straightforward for the doctors that you might be seeing to then have not only just a look, but also to have a listen as to what's going on. And then the other sort of things that you might be found is findings that parents didn't put two and two together, but they might be visiting the dentist, and the dentist may find things as soon as they look inside the mouth, and that's not unusual. In fact, the dentists as a professional group seem to be very, very clued into this problem in terms of the virtue of the fact that they're looking inside people's mouths as part of their daily routine.
So if you do have a child and you are concerned about their quality of sleep, or that they're snoring, or that they are having obvious breathing problems, what do you do?
So the important thing is not ignore it. And the next important thing is to be proactive. So you need to be that parent that doesn't take no for an answer. You need to be that parent that seeks out a referral to a pediatric ear, nose and throat specialist, one that specialises and has an interest in children that can't breathe and sleep properly. Ear, nose and throat is a very big specialty. Everybody thinks that we are all the same. The reality is that there's so many parts of ENT is that there is no person that can do everything and can't keep up with everything. So it's not just a matter of getting a referral to see the ENT, but you want to see the ENT that basically deals with these sorts of problems on a pretty regular and frequent basis and is up to date with the latest research and science, particularly as there's still a feeling or a message that's out there that's okay to let the children outgrow it. The science and research has shown that these children actually do very poorly if left to their own devices. They do much, much better if they can breathe and sleep properly. And then the next question that follows is, how quickly do we need to deal with it? Well, I have a little analogy that is that if someone was breaking into your child's bedroom and you walked in and saw somebody choking your child at night, at what point do you call the police? And nobody hesitates to say straight away, and of course, get this person off their child. Children that aren't breathing properly are having these breathing and sleep problems at night. It is actually exactly the same thing. It's that the child is doing it to themselves. So there's a mindset there that we just need to sort of raise awareness and understanding that not only is it abnormal, but it's often, even when it's found, undertreated.
Yeah, so you said that sleep apnea in children is quite often misdiagnosed as ADHD. So that's rather common.
So when we look at the science, so we're talking about the published literature, I think it's important to know, what are people finding when they go and do this research. So what they're finding is that 25 and maybe as high as 50% of children walking around with a diagnosis of ADHD have some form of sleep apnea or other form of what we call sleep disordered breathing, which is trouble breathing at night. And when we treat those children and relieve the obstruction, after, again, the research shows after about 6 to 12 months, you go and look at these kids again, they're all back to normal. So we need to make sure, again, that we make an accurate diagnosis. And some children have ADHD and breathing problems. Some kids can have both. And again, in those scenarios where the children are treated for both, the research again shows that these children do a lot better having had their breathing sorted along the way. So when we look at populations, we use some rough figures. So for adults, we're talking around about 10 to 30% of the population, depending on what your population is like. And when we look at children, it's about 10 to 20%. So similar sort of percentage ranges. So across the population range, children and adults alike, as you said, we've got somewhere between 4 to 6 million people with this condition. And what we know, based on other surveys and research and science, 85% at the moment are undiagnosed. So when we do the math we say, let's just use some round numbers here. So if we say 20%, let's just say we've got 20 million, we go to 4 million. If we're talking about 85%, we're talking about, roughly speaking, 3.5 million people just in Australia who have a significant medical condition that will lead to premature death, increase the risk of having a fatal car accident, having a significant pathology such as high blood pressure, diabetes, mental health problems, learning problems, education problems, and the like. I mean, the list is really quite substantial.
Yeah.
So this is absolutely a diagnosis that we cannot afford to be missing really any longer. We've done a very poor job when it comes to managing this condition, and we've done a very poor job before we even get to that step of even just diagnosing this condition. And a lot of it, as you've alluded to, comes down to education and awareness, not just of the general public, but of healthcare professionals. One of the great problems we have is that sleep as an entity is roughly speaking around about a third of our lives.
Yep.
So we have 1/3 of our lives that is spent asleep. When we go to medical school, we get our medical education and training. We would probably, over sort of take a 6-year program, roughly speaking, university term might be 40 weeks. So let's just round that to 240 weeks of education, times by 5, just doing the math, 1,400 days, times by the number of hours, say 8-hour full day. We've got roughly 10,000, medical education hours. Probably no more than 2, 3, or 4 of those hours would be spent on sleep. When you look at the percentage of life spent asleep and the medical conditions that are brought about through dysfunctional sleep, we need to go back to grassroots and get the medical fraternity re-educated and recalibrated as well, so that everybody is singing from the same song sheet with the same determination and understanding of the severity of this condition.
Well, it certainly does sound like it boils down to education, and that we do need to re-educate our GPs, because that's where people start. And unfortunately, they don't get past that stage. And as you say, a lot of that has to do with the fact that sleep isn't appreciated, and we really do need to push the government to acknowledge that more resources need to go into sleep education and sleep research, so that we can become more aware of the disorders that affect people so greatly.
Absolutely.
So is there anything that you would like to say that we haven't covered at the moment?
Look, I think it's it's very important for people to understand that it's not the GP's fault that the education on this is so poor. It is a system problem in terms of basically how we've regarded sleep as a society. We haven't really taken it very seriously. We haven't given it the importance and so forth that it's duly deserves. Mostly because we've had an area of ignorance. Sleep was the thing that we got around to doing when everything else was done, rather than it being a normal, scheduled and important part of what should be our daily routine and lifestyle. So I think that anyone that's encountering issues or problems in terms of being taken seriously and the concerns being taken on board, use that as basically an opportunity for everybody to learn, rather than making it too much of a source of criticism. But at the end of the day, patients and parents need to be proactive. There's absolutely everything to be said about taking your own health into your own hands, and then using the knowledge that you have to better yourself. And also, if that involves needing help and assistance from medical people, is making sure that they have some understanding and insight as well as to what's needed.
Yes, absolutely. It can take years to be diagnosed with any sleep disorder, and much of that relies on the patient's communication with their doctors. If we're not speaking the same language, a lot of things can go unnoticed because the doctor doesn't quite understand what the patient is trying to explain. And if the patient doesn't understand themselves, then unfortunately the length of time to diagnosis can be extended unnecessarily. So thank you
Absolutely.
very much for taking the time to speak to me today. We really appreciate it. Usually our sleep apnea awareness day is something that we like to get out in the public to do, but we haven't been able to do that this year. So we really appreciate your time. Thank you very much.
It's been a real pleasure. It's a great initiative. Let's keep it going.
Yes, we certainly will. Thank you very much.